Hello, my name is Ebere Udeogu. Today I'm going to talk about obstructive sleep apnea, why it matters for heart health and daily life, and how neurodiagnostic sleep technologists play a big role in diagnosing and treating it. This is the final presentation that coordinates with my final paper that's called When Sleep Steals Your Breath, and this is about obstructive sleep apnea. This disorder is really about what happens to breathing when people think they are resting. So, what is obstructive sleep apnea? Obstructive sleep apnea is a sleep-related breathing disorder. During sleep, the upper airway becomes too narrow or closes, so air cannot move in and out normally. When this happens, the person may snore, choke, or stop breathing for several seconds at a time. Oxygen levels go down, carbon dioxide levels go up. The brain briefly wakes the person up just enough to reopen the airway. Most people do not remember these awakenings, but they can happen many times every hour, all throughout the night. That constant interruption is what makes obstructive sleep apnea such a big problem for health and how people feel during the day. So, how common is it and who is at risk? Obstructive sleep apnea is much more common than most people think. Large studies suggest that hundreds of millions of adults around the world have at least mild obstructive sleep apnea, and many have moderate to severe disease. The risk goes up with age and with obesity. Men are affected more often than women, and people with a thicker neck, crowded airway, or certain jaw shapes are at a higher risk. Alcohol, sedative medications, smoking, and sleeping on the back can make it all worse. It is important to recognize that some groups, such as Black and Hispanic patients and people with lower incomes, may have more risk factors, but less access to sleep testing and equipment. That creates a big gap between who needs care and who actually gets it. So, what happens to the body when it experiences obstructive sleep apnea? Inside the body, the problem starts with a floppy or narrow upper airway. When people fall asleep, the muscles in the throat relax. In someone with obstructive sleep apnea, this is enough to let the airway close. Each time the airway closes, oxygen levels fall and carbon dioxide levels rise. The body responds with a burst of sympathetic activity. That means more adrenaline and a jump in the heart rate and blood pressure. So then the brain then wakes up the person just enough to reopen the airway. This creates chronic intermittent hypoxia, which is a repeated pattern of low oxygen and recovery. Studies show that this pattern can cause inflammation, injury to blood vessels, and long-term stress on the heart. It keeps the body in flight or fight mode, even during the day. The effects on the heart and brain. So, over time, obstructive sleep apnea affects many systems of the body. One of the biggest areas is the cardiovascular system. Research shows higher rates of high blood pressure, coronary artery disease, stroke, heart failure, and arrhythmias such as atrial fibrillation in people with obstructive sleep apnea. That's why it's so important for people to go get diagnosed. But we'll talk about that later in the presentation. It also affects the brain in daily life. Because sleep is constantly broken, people often feel very sleepy during the day and they have trouble paying attention and report memory problems or mood changes. Though this sometimes can be seen in obstructive sleep apnea can be seen in older ages, but this can happen in younger people too. Especially think about students, sleepiness during the day, not being able to focus during class, and having a lot of mood changes can affect college life. It can affect everyday life. This can lead to car crashes, workplace accidents, and just a lower quality of life overall. So when we look at tracing full of apneas and desaturations, we are not just looking at lines. We are looking at events that can affect blood pressure, heart rhythm, and how that person feels and functions every single day. So, how is it diagnosed? Because snoring and tiredness can have many causes, obstructive sleep apnea usually needs to be confirmed with testing. You can't just say you have obstructive sleep apnea because you snore or because you're tired, because there's a lot of different sleep science studies that we learned about in this course that prove the same symptoms. So it must be confirmed with testing. So doctors may start with tools like the Stop Bang questionnaire or the Epworth Sleepiness Scale. These help identify who is likely to have obstructive sleep apnea, but they do not give a final diagnosis by themselves. The main way sleep technologists diagnose obstructive sleep apnea is in the laboratory with a polysomnography. The study records brain waves, eye movements, muscle activity, heart rhythm, airflow, breathing effort, oxygen levels, and eye position. From that, we can count apneas, hypoapneas, and calculate the apnea-hypoapnea index. From some adults with a high chance, for some adults with a high chance of moderate or severe obstructive sleep apnea and no major other problems, home sleep apnea testing can be used. These devices record fewer signals and cannot see sleep stages, but they are more convenient. If a home test is negative and symptoms are still strong, the person usually needs a full lab study. But this is a changing field, a field that is continuing to develop, but we'll talk about that later in the presentation as well. So, what do sleep technologists do? Neurodiagnostic sleep technologists are at the center of this process. They are often the main person that the patient interacts with on the night study. They greet them, take a brief history, and explain what will happen in a plain language so that the patient feels more comfortable. They apply the EEG electrodes using the 1020 system, place the respiratory belts, pulse oximeter, airflow sensors, and all the other leads. Then the sleep technologist will run the study, monitor the signals in real time, and fix artifacts or loose sensors as they appear. In split night studies, once there's enough evidence of obstructive sleep apnea, early in the night, they may begin positive airway pressure titration following the lab protocol. After the recording, the sleep technologist usually scores sleep stages, arousals, respiratory events, and desaturations according to the American Academy of Sleep Medicine rules. Accurate scoring is key for correct diagnosis and treatment decisions. So treatment and long-term management. Treatment has a few goals. Sleep technologists are working to reduce or stop obstructive events, improve oxygen and sleep quality, relieve daytime symptoms, and lower long-term health risk. Lifestyle changes are important for almost everyone, especially things like weight loss and exercise in patients with obesity and avoiding alcohol or sedatives before sleep. These changes help, but they usually are not enough by themselves for moderate or severe obstructive sleep apnea cases. The main therapy for most adults is continuous positive airway pressure, called the CPAP. It's a machine that sends air through a mask and creates a gentle pressure that keeps the airway open. During a titration study, technologists raise the pressure step by step, adjusting the mask, and watch the tracing to make sure apneas, hypoapneas, and snoring are controlled. Some patients use oral appliances that move the jaw forward, or have surgery or newer treatments like hypoglossal nerve stimulation. No matter which therapy is chosen, follow-up and support are important, and technologists often help with mask fitting, data downloads, and problem solving. So, equity, telehealth, and future of sleep apnea. These are important equity issues. There are important equity issues in obstructive sleep apnea. People from minority racial and ethnic groups, those with lower income, and those in rural areas may have a higher risk, but less access to sleep labs and equipment. Insurance coverage can be confusing, and some patients may not trust the healthcare system or may not receive clear explanations. Sleep technologists can make a difference here. They can spend time with the patient in the lab and sometimes on the phone, By listening, using a simple language, and respecting each person's backgrounds, they can help build trust. They can also tell physicians about barriers that patients share with them, such as transportation problems or cost concerns. The field is also always changing. So there is more use of home sleep apnea testing, telemedicine visits, and remote monitoring of positive airway pressure data. New software and artificial intelligence tools are being developed to help with scoring and analysis rather than replacing technologists. These tools will likely shift the work toward checking automated results, focusing on complex cases, and spending more time on patient education and support. To wrap up this presentation, obstructive sleep apnea is very common and an important disorder. It is not just snoring, it is a repeated airway collapse that affects breathing, heart health, and how people feel and function every day. Accurate diagnosis depends on sleep testing, and neurodiagnostic sleep technologists are in the middle of that process. They set up and monitor studies, score events, and help with positive airway pressure titration, and support patients as they try to adjust to the treatment. As the field moves toward more home testing and remote monitoring, there will still be a strong need for technologists who understand both the science and the human side. Technology can help, but patients also need clear explanations, patience, and encouragement. Thank you for listening to my presentation.